If you are tired of looking tired and your under eye circles are darkening, are making you look older than you are, this episode is for you. I'm Dr. Mary Osmina. Welcome to the Skin Reel. On this week's episode, I am talking to board certified dermatologist Dr. Rebecca Kazin, all about treating the tear trough area. And that is basically the under eye area, which can look hollow, it can look dark, it can look puffy and swollen. And if our eyes are the windows to the soul, you want your eyes to look amazing and look the best they can. And that's where things like tear trough filler plays a role. Dr. Kazin is an expert in all things dermatology, especially cosmetics, and she practices in Bethesda, Maryland at ICON Dermatology. And she's going to be sharing with us what works, what doesn't, and how to make sure you are getting natural, beautiful results with your tear trough treatments and filler and not getting a unnatural, puffy, or bizarre look under there. If your eyes are making you look tired, you definitely want to check out this episode. Dr. Kazin, thanks so much for being here. I'm super excited to talk about specifically tear trough filler because this is an area that I think it has a lot of controversy.
Yes, it definitely does. And it can be done very well or very poorly.
I sort of feel like it's with all filler, like you don't notice the good filler. So then when you see bad filler, you tend to think, oh my gosh, filler's terrible. You can't get good results with it. But it's also because we don't see when it's done well. And I think that's kind of the same thing with tear trough filler, right?
100%. It's such a small area and it's such a delicate area that you really have to pick the right provider.
100%. So we're saying tear trough filler, but what is the tear trough?
Right. So first I'll say everyone has one. It's basically the under eye area. Children have them. It's kind of the area that almost separates your lower eyelid from your cheek, which is an important anatomic landmark, which is why sometimes it looks strange if you overfill it because it looks like your cheeks end at your lower eyelashes. So there should be a little bit of a depression there, hence the name trough. And so it's basically the under eye area. And what we're trying to achieve is what we call a smooth transition, almost like a ski slope from the lower lid eye to the cheek, to like the apple part of the cheek. And so as we get older, lots of things can happen and it can unmask some volume loss there. So it can be more depressed and look darker because of shadowing. Some people get puffiness there. Some people get the double whammy of puffiness and then an indentation.
And darkening.
And darkening, right. And so, it's multifactorial, but what's exciting is we as dermatologists understand more and more what is happening underneath the skin with aging. And so we're trying to be more precise in our treatments to increase how natural the results look.
I think sometimes people just universally will say, they'll call them bags under the eyes, but it's maybe really, it's not bags that's the problem. It's more that there's a shadow or there's discoloration or it's blood vessels or, it could be a lot of different things. And so you're 100% right. Like we need to know specifically what's the issue because it's not a one size fits all filler for everything, right?
Exactly. And I have found personally the best results I get are, unless the person is young, like 20s, 30s, and you might be able to pick one modality, but most of my patients are like Gen X or boomers. So generally I need to combine like an energy-based device, likely with filler, to get a really nice result.
So I'm in my 40s now. I'm like right on the cusp of millennial and X. And this and neck seems to be like top concerns for my friends and my patient, and definitely an area that people are wanting treatment. So speaking specifically about filler and probably hyaluronic acid filler, right? Who is a good candidate for